right, get going. All right, good morning, everybody, and welcome to WSAN Radio. And we are here today with an interview with Dr. Hooks. I met this young lady at an event, and I tell you, she had a wealth of knowledge out there and resources out there. So I invited everybody that I met to come on the show and talk about what they do and how can they reach you and I can't continue because I'll mess it up exactly what she does. But Dr. Hooks, can you tell our listeners a little bit about yourself and what inspired you to start Hooked on Wellness Consulting?
Yes, hi. Greetings, everyone. My name is Dr. Alexandria Hooks. I'm the owner and sole provider of Hooked on Wellness Consulting. It's a clinic. And I should also mention joining me is Rome Hooks, my office manager and spouse. At Hooked on Wellness, we provide a myriad of services, primarily direct primary care. My specialty is weight management, medically supervised weight management. I also do hormone replacement, and vitamin infusions. We, I decided to start this business because I just got tired of seeing the way healthcare is the direction it's going towards. It's a sick care model, and it doesn't focus on prevention or making sure that people are becoming healthier. It's just about treating illnesses and oftentimes about meeting insurance criteria and quantity versus quality care. And I wanted to make sure that I provided care that's accessible, clearly understood, affordable, and something that feels personal and not rushed. And I give my patients at a minimum of an hour if they need it, or sometimes more. And in traditional medical clinics, you're in and out in 10 to 15 minutes.
Yeah, I agree with you on that. Uh,
Mhm.
I got rid of one doctor because I get there my 10 o'clock appointment. I don't get seen to 10:45. The nurse come in and does everything. They come in and say, "Well, the nurse said you do." Okay, bye. Huh? Wait. What about concerns? Oh, you have concerns? I wouldn't be here if I didn't have concerns.
Mhm.
Right.
you know. So, tell us your practice focus on mind, body, and spirit. How do
Yeah.
those three areas work together when it comes to overall health?
Well, our mission is to help people become the healthiest version of themselves. And with that being said, we have a comprehensive whole person approach where we address mind, body, and spirit for an optimal level of wellness when you have balance in all three of those areas. Sometimes in traditional healthcare, you'll see where people see you as a disease or a condition or an organ system that they're treating. They don't see the whole person. We're a faith-based clinic, I should say. And that's where the spirit component comes in or soul comes in. And what I do is, in trying to be comprehensive and thorough and address the entire person, I look at each of those areas of someone's life to make sure they're in balance. And we also incorporate or integrate our faith based care into evidence based lifestyle medicine that also includes nutrition, fitness, emotional health, mental health, um, reducing risky behaviors, helping people cultivate social support, and providing that spirituality piece. We even have Christian counselors that we provide patients access to for free. It's free. So we have psychological counselors separate from our Christian counselors. We have fitness trainers for the to help with the physical component, and we just try to meet everyone's needs in all of those uh, dimensions of wellness, if that makes sense.
It does. So, what are some of the biggest health concerns you are seeing in San Antonio community today?
Weight, which is a chronic illness in and of itself, and the comorbidities that go along with it, that weight contributes to, like high blood pressure, diabetes, high cholesterol. That's usually the triad of issues that go along with being having excess weight. But I treat all kinds of services, all kinds of chronic conditions, um, not to just mention those three or four, but I also treat thyroid disease, asthma, other chronic conditions, and then also acute issues, ear infection, sinus infection, throat, strep throat, urinary tract infection, cough, cold, asthma flare-ups. We treat it all here.
May I interject?
Yeah.
One of the things that I've noticed that kind of, I guess, affects me or affected me is we'll have young patients come in, I'll say between the ages of 20, 25, and they'll be coming in for one thing. But when we do a blood test on them, we find out like they may be pre-diabetic.
Mm.
Things that they weren't even thinking about. But it's important to find out what's happening early, so then that way you can get on top of managing it, preventing you from having a serious case, whatever it is. So I would say that younger people don't tend to go to the doctor or really care about insurance or any of that kind of stuff because they're like, I'm barely sick.
Yeah.
Yeah. It's been the case that we'll have somebody young come here, and after doing tests we'll see like, well, you kind of have an issue right here. So
And I think that leads into something that's very important is preventative care. Oftentimes, insurance won't pay for preventative care services, and it's important to find things out early on before it becomes problematic. And unfortunately, that's when insurance will kick in is after the fact, once you already develop a disease state. And so, what sets us apart is our direct primary care monthly subscription plan that's only $59.99 per month. And it's unique because, number one, it's very affordable. And it includes an annual physical, annual labs, chronic conditions, acute conditions, unlimited visits, and a number of other services are all bundled in that 59.99 per month plan, and it only comes out to $720 a year, and that's less than most people's premiums and deductibles for that matter. So we have patients that have insurance and patients that don't have insurance as an alternative or a supplement. But with that being said, when you are paying out of pocket, because we don't accept insurance, but when you're paying out of pocket, you have the say of what you will and won't pay for. And for those people that want to be proactive and focus on prevention, they can agree to do those tests that can help find out disease processes early on before they become a problem, even though they may not even have any symptoms. Let's say you've got a family history of certain conditions. Well, we can test you for that and detect it early. And another thing to mention is that our membership is really popular for uh, a certain uh, type of consumer. You want to talk more about that?
yes. So we found out that just looking at research that there are a lot of people who are in like say the hospitality industry that do not have health insurance coverage because usually those things aren't offered by their employer. So it's been very helpful for them. And also, believe it or not, small business owners, a lot of them can't even afford having their own medical insurance because it's expensive. I mean, she and I struggle with ours just to try to keep it. And so that it's just getting outrageous on how much insurance costs. So again, that's one of the things that drive us is that there's got to be something where people can get, basic primary care services at a reasonable price. So yeah, this is a perfect plan for those who have a job someplace that do not offer insurance, or for small business owners. They may even want to provide this for some of their employees because they may not be able to afford giving them health insurance, but this is something to where they can at least go to the doctor, get checkups. If they have cold, cough, flu, or don't feel good, they can call in, get a telemedicine appointment, send them medication so they can get their meds and go back to work. Those types of things that will be provided for them that, without it, they would be kind of stuck.
Yeah, it's an additional benefit that employers can provide to their employees, not just to have their employees be healthier, happier, more productive, but to get them back to work a lot faster. Because as he mentioned, we do have telemedicine and in-person visits, and we try to have telemedicine available, which I do have Texas wide, mind you, to make it more convenient. We also find that freelancers, people that are between insurances, people with high deductible health plans, employees of small companies, independent contractors, entrepreneurs, or people who just simply want a more direct relationship with their primary care provider. Because with that 1 hour, I can actually take the time to get to know you as a person and not just a health problem. And we can build a rapport, and I can listen to your needs.
Yeah, that point right there. So let me ask you something. With your cost and everything you're doing, uh, it says that we got to have some type of insurance, or we get penalized. Does that take the place of having insurance on what you're doing?
No, DPC is it's kind of an add-on. So being a part of a DPC plan, it's kind of like an add-on, but it does not replace health
Okay.
insurance. That's
Yeah,
the one
it is
thing.
not health insurance.
Okay.
It is not health insurance at all.
So I've always, whenever I tell people who are kind of questioning, like, well, is it worth getting onto a DPC plan? I'm like, yes, because you can get like the cheapest insurance that you can find for catastrophic events. Because if something happened, like a serious bill, we're talking 5, 10, $20,000, at least you have that insurance so you don't have to pay that whole amount.
Right.
With our plan, you actually can get uh, uh, appointments the next day.
Same day or next
Same
day
day. So it's not like a lot of other insurance. It's like you have to wait, what, 2, 3 weeks?
before you can get in to see your provider. And we also have walk-in appointments.
Mm-hmm.
And we do accommodate people when needed who have busy work schedules for after 5 o'clock and on some Saturdays.
Okay. Well, you know what? I have four more questions, but y'all answered all of them already. Well, y'all went into the preventive stuff. I had a question, but that's good. That's all right. That means that we're on track on everything. So let me ask you this. Um, how do you help patients create realistic health goals instead of relying on the quick fix or fad diet?
We personalize care. We, like I said, take our time to listen, do a thorough, comprehensive assessment, whether that be with labs, full lab panels, or other diagnostic testing, like we have an in-body body composition analysis um, piece of equipment, and it measures more than just weight. It measures like visceral fat. It has a lot of um, variables that it measures and takes into account to determine what your health status is. And once I do that thorough assessment, using all of our diagnostic tools that we have available to us, I can develop and form a comprehensive plan in all the areas of wellness, mind, body, and spirit, in a collaborative approach. I don't just dictate to the patient, well, you're going to do A, B, C, and D. No, I work with them to not only figure out what they can do, but what they can't do, what they're willing to do, what they're able to do, what resources they have, what resources they need to be able to accomplish their goals. But I do not do a cookie cutter approach, like one size fits all.
Right.
I tailor and personalize care based on what that individual wants and needs
Mhm.
and in
And
what's safe.
and we
Okay.
also just to help people, I guess, in that journey. My wife is very good about not shaming people, things like that. So we understand things in life happen. So if something goes wrong and you didn't eat right for that week or whatever it may be, you're not gonna no one's gonna chastise you because we understand we just start over and we really want to work with you and be with you along that entire journey. And then we also have, like she said, the counseling. They'll help you develop goals in order to meet where you're trying to get to, smart goals. So you do it in little increments and not these big daunting goals that you're trying to do, yeah,
Realistic.
that are unrealistic.
Mm.
And I'm even trying to figure out some of the barriers. What is it that's preventing you from reaching your weight goal? Because it may not just be, oh, I'm overweight. It could be something from trauma or something like that. So that's why we always felt it was very important to also work with counselors because, like she said, mind, body, and spirit, it's all connected. So you have to look at the whole person when it comes to developing a treatment plan for them.
And faith-based. We don't push our faith on anyone. We don't discriminate. If people ascribe to, spirituality, great. If they don't, that's fine too. But because we are faith-based, we always make sure we extend grace. Because without God's grace given to us, you know, how can we not do the same for other people? So I don't have a domineering approach with patients. I give them grace, I meet them where they're at, and I help them achieve their goals um, uh, accordingly. And with that, I give them encouragement, I help them feel empowered, I give them affirmations. I really believe in that mental and emotional piece when it comes to not only weight management, but all health conditions.
Yes.
Okay. Let's switch gears a little bit. Hormone replacements. Therapy has become very popular. Who might benefit from having their hormones level evaluated?
So, as we age, our hormones change and decline. Actually, our hormones uh, shift throughout our entire lives. But as we age, it's more noticeable. So as you get older, you may enter into a state where you start noticing changes, believe it or not, with mental clarity. You may have mental fog. You may not have the energy you used to. You may have muscle atrophy. You can't build muscle like you used to. Sex drive, mood changes, um, all of that can be signs of um, uh, hormone issues. And so I do a comprehensive workup for men and women. I'm not like some of those hormone clinics, and not to talk poorly about anyone, but I believe in safety. I'm not just going to throw hormones at someone because they think they have a hormone issue. I'm going to actually do the work and do testing to confirm what it is, because you may assume it might be your hormones when it might actually be some other underlying issue that has similar symptoms. And so we're going to treat the root cause, number one. And then number two, I'm going to also assess whether you have risk factors that make it contraindicated for you to have hormones. Because if you have certain conditions, hormones may not be a good option for you. Or if you do get on hormones, I'm going to monitor your labs. There are some people, like men, who develop elevated prostate levels, PSA, prostate antigens that rise when they're on testosterone and can contribute to the development of prostate cancer. So that's why it's important to have those managed and not just have anybody out there treating you who's just in it to make money and just pass out hormones like candy.
Yeah. Yeah, that's so true. Because some of the athletes that figure that's what they need to buff themselves up. They don't look at down the line what could happen to them.
Hmm.
Yes, hormones are can be very beneficial, can be very helpful, can help with an overall sense of well-being and wellness, and can have a protective benefit as well. But they also can put you at risk for stroke, heart attack, blood clots, and cancer. So it's a very serious service that I take seriously.
Okay, so um, we're gonna go back to high blood pressure and diabetes. Many people are dealing with those two, along with high cholesterol. What lifestyle changes they could do that could make the biggest difference?
Weight loss and lifestyle changes in the areas of fitness and nutrition. It's important to get in at least 150 minutes of cardio per week, but you can gradually work your way up to that. I don't tell people, oh, you need to do cardio 150 minutes per week, eat less, exercise more. I don't give those very generic overused statements that unfortunately is what a lot of providers were trained to do in their educational programs. I go into more depth in meal planning and nutrition education and fitness plans, and I have fitness coaches that I refer to for discounted prices. And also, believe it or not, some insurance companies will pay for physical therapy for certain conditions to help people with physical conditioning, endurance, and stability, and gait and balance when they're trying to incorporate more fitness into their lifestyle. But weight loss significantly reduces cardiovascular risk, worsening of diseases like diabetes and hyperlipidemia. And even some cancers, you didn't mention cancer, but are a number of cancers. I can't recall all of them off the top of my head, but that can be uh, um, caused by excess weight.
Hmm. Okay. Wow. So I'm gonna go back to what we talk about the blood work and stuff. Um, what should people know about getting regular blood work, annual physical examinations? You know, I could talk to a lot of people say, "Well, I haven't been to a doctor in 5 years. I'm fine. I haven't done this in five." Well, what you just mentioned, you need to get in there and do the blood work because you could find something early. So, how important you could stress to people, they need to get that done yearly.
So at least start out with a baseline annual physical so that we can see where you're at with your blood levels with certain labs. And then we can take the interval from there. But certainly people who are young and healthy don't necessarily need to go every year, but at least get one initially as a baseline because you can have something and not even be aware of it. And then as you get older, it is important to have an annual physical. And it's important to not only have an annual physical that includes blood work, but at certain ages, you need a mammogram, you need a pap smear, you need a colonoscopy. All those are preventatives. You need your routine vision screening, routine dental checkup. Um, and some people, like diabetics, need a, annual diabetic foot exam or an ophthalmology appointment to check for diabetic retinopathy. Um, and it just depends on what your risk factors are, your age, and what current conditions you have, that helps us determine intervals.
Mm. Well, you said all that right there. I'm not guilty of it, but I do have some of those symptoms that I have been going to the doctor, taking care of, and everything. And I'm type 2 diabetic. And matter of fact, when I switched doctors a year and a half ago, um, she took me off some medicine already because everything was looking good. And then the main thing was it really shocked me because my high blood pressure. And I don't feel like I have, and I told her I don't feel like I have. Well, we're gonna check all that, find out what's going on with. We're gonna find what's going on. For 6 months straight, she said your blood pressure is like a 35-year-old man. I think we're not gonna have you take that medicine anymore. And another 6 months went by without the medicine. It's still exactly where it's at. She asked me, "What are you doing?" I said, "Well, actually, I stay busy. I go to the gym. I try my best to eat right, and I don't eat late at night like I used to. And so I just did a whole lifestyle change. That's all I did. I just instead of using the word diet, it's a lifestyle change for me, and that's what I did. And you know, at first, oh, let me tell you, unsalted crackers and other stuff was so nasty, but I got used to it. I got
Yes.
used to it. I said, this
Good.
this is what I need to do, and I got used to it. I even got my wife on the bandwagon now, eating. She always ate healthy, but she's watching what I'm eating. Oh, let me try that. Things she haven't tried, I'm eating. She tried it. Now, this is a downside. I can't keep what I like because she like it too.
You have that problem too.
Yeah, I did some. Oh, don't worry. I just eat some of yours. I'm gonna go back when kids was growing up. I'm gonna put my name on the fridge on that right there, and then a cabinet on that right there. And she started laughing. That don't do no good. I said, "Why is it? I don't read." But with that being said, um, let me see. What services currently available through your Hooked on Wellness Consulting?
Our services currently available include anything that falls under primary care, addressing chronic conditions, acute conditions. We have a full lab. We have an EKG machine, pulmonary function machine, audiogram for hearing testing. We have, or hearing screening. We have vision screening, color blindness testing. I have a nebulizer to treat asthmatic flare-ups. We do a lot of point of care testing, strep throat, urinary tract, pregnancy testing. Um, and like I mentioned, all the chronic conditions earlier: diabetes, cholesterol, high blood pressure, thyroid disease, anemia, chronic constipation, mental illness. That's another thing that's super important.
Mm-hmm.
I have a passion for mental illness. Within my scope, I treat anxiety, depression, stress related issues, and also bipolar if it's well controlled and doesn't need medication adjustments. And those that are outside of my scope, like schizophrenia, schizoaffective disorder, psychotic issues, I'll refer to my colleague down the street, a psychiatric facility that's very close by our clinic that does a fantastic job. And they also do other modalities besides medications that help address people's mental health conditions. But I mentioned weight management is my specialty. We have specials right now, vitamin injections, also other micronutrients and supplements right now I have on sale. NAD and glutathione and a fat burner called L-carnitine for $30. They're usually $75 each, and I've got them on sale right now. They help with workout recovery, energy, mental clarity, mood, fatigue, help improve sleep, and with burning fat, respectively. So we do a lot. We also do a lot for employers. That's where we're emphasizing our services to now is employers and those who are independent contractors or self-employed and can't afford health insurance. We're a great resource for those types of industries.
Okay. Okay. So, being that said, how can someone schedule an appointment with you?
They can give us a call at 210-528-1042 or go online to our website, gethookedonwellness.com. We have booking links on there. Or they can just walk in, come to the clinic, 8500 Village Drive, Suite 201, San Antonio, Texas, 78217, and schedule an appointment directly.
Okay. Finally, what message would you like to leave with WSN radio listeners about taking control of their health?
Taking control of your health. So we don't just simply get you in and out. We believe in helping people focus on mind, body, and spirit for an optimal level of wellness. And we empower you to take back control of your health condition and health goals. And we believe that healthcare should be personable, accessible, understandable, and affordable. And we just want to make sure that people are properly educated and focus on not only treating issues but prevention and be accountable for your health. Oftentimes, I have people who react to sickness and then come in, but let's focus on wellness and use motivations like I've had people tell me, well, I want to make sure I'm here for my grandchildren. I want to make sure I'm healthy enough to be able to play with my grandchildren. I want to be here and spend more time with my wife. I don't want to be debilitated. I want to be able to be functional and enjoy my life and not be worried about pain or illness. So there are a lot of motivators besides wanting, for example, wanting to look good and lose weight out of vanity.
Yeah.
In First Corinthians, it talks about our body as a temple, and to honor God, we should take care of our temple. And that's what I would encourage people to remember the most is that you are blessed with this body and
Hmm.
take care of it.
Yes. All right. One final question. If you could get every person listening to do just one thing for their health this week, what would it be?
Hmm. You know.
I'm gonna say drink more water.
Yeah.
Water is great. Less sugar.
Yes.
If you can trade out a soda with some water, I'll give you some grace. You can put in what is it, a zero sugar soda. But yeah,
Not no the zero sugar packets, flavor packets in your water to help you. But yeah,
Okay.
water is a good one. And move more movement. We need more mobility.
Yeah, I agree with you on that because I drink plenty of water every day.
Mhm.
I went and got myself this little crushed ice machine. I fill it up every morning to keep my bottled water. Because I
Mhm.
was a big time beer drinker back in the days.
Mhm.
But when I turned around and figured I needed to change, instead of filling my little refrigerator up with beer, it's now filled with water.
Mhm.
So
Nice.
that's what I do. But you know what's tough?
Mhm.
Football season. I don't know what it is about beer and football season. It's so tough.
Uh-huh.
but but I challenge myself not to do it. So,
Mhm. Mhm.
And
but
you know, our goal in helping people um so they don't get discouraged, we tell them it's about progress, not perfection.
Mhm.
So we just want them to remember you've got grace with us, and we just want to be a partner with you on your journey to better wellness and becoming the best version of yourself.
Mhm.
okay. Again, thank you for coming on the show today. Our listeners are y'all blessed today to hear this right here, and just get up and go see what's going on. Matter of fact, give the information again on how they get a hold of you and the website.
Certainly, you can either call us at 210-528-1042. You can leave a message. If you're not able to get a hold of us right away, we do return all of our calls within the same business day. You can stop by our clinic at 8500 Village Drive, Suite 201, San Antonio, Texas, 78217. We're located right off of 410, right off the highway on the access road. Or you can go on our website and book online at gethookedonwellness.com.
Oh, I like that. I like that. All right, we appreciate you taking time out joining us today.
Thank you.
Having us.
All right, hold on, don't go anywhere.